Hi, this is Dr. Les, and welcome to another episode of Beef Minutes. We just finished working this set of replacement heifers out at the Woodford County Beef Farm. Today is October the 12th, and we are about 1 month from these heifers entering the breeding season. Our goal, 1 month before the breeding season, is for our heifers to be a frame score 5 to 5.5, body condition score 5 to 5.5, and weighing somewhere between 750 and 850 pounds. As you can see, we have a crossbreeding program here at the University of Kentucky. We started off with original purebred Angus cattle, and now we have Baldies, so Hereford Angus cross, and we've used some Charolais and keep an occasional Charolais heifer. And you can see one Charolais cross heifer in this bunch. We do several things 1 month before the start of the breeding season. First, we weigh the heifers to make sure that they're hitting their target weight. Second, we take a pelvic area measurement to ensure that our heifers can have a 70-pound calf without calving problems. Third, I do a reproductive tract score to ensure that the heifers are cycling. And then fourth, we do phenotype disposition scores, where we're looking at feet and legs, and then we're looking at a chute score to make sure that we're not keeping any heifers that are going to be a little bit goofy. Our goal is to breed these heifers around November the 20th, and we'll have videos to correspond with our AI of these heifers. Now let's look at how the pelvic checks went and how we accomplished the pelvic check. Pelvises are normally measured using a rice pelvimeter. Other items needed are a bucket of antiseptic, lube, plastic gloves, and palpation sleeves. We are also vaccinating these heifers today for respiratory disease complex, lepto, and vibrio. We are using the modified live version of respiratory disease complex because we need these heifers to be protected at the cellular level against BVD and IBR. We are vaccinating these heifers approximately 40 days before the onset of the breeding season, which is ample time to stimulate good cellular immunity to the respiratory disease complex, and yet not too close to stimulate reduction in conception rate. These heifers have also been dewormed. To obtain an accurate pelvic area measurement, we first need the weight and age of the heifer. Then we can go to a table generated by Gene Deutscher at the University of Nebraska to get the appropriate conversion factor. Put a sleeve on, put some lube on, and then we go per rectum and do a reproductive tract score. Reproductive tract scores range from 1 to 5, and a tract score of 4 means the heifer is cycling. To obtain the pelvic area measurement, we will insert the rice pelvimeter and measure from the bottom of the spinal column to the top of the pelvic canal. This vertical measurement is 13. We'll then rotate the pelvimeter and measure at the widest distance horizontally. This measure is at 13.5. Then we multiply those two numbers and divide by the conversion factor to get the acceptable birth weight for the cow. After a little disinfectant, we're ready to go to cow number 2. As the heifer is leaving, we examine her feet and leg structure and look for any disposition or conformation issues with that heifer. When we watch feet and leg movement, we want to make sure that the animals are standing square on their feet and legs, and we want to make sure that the heifers aren't nervous and that disposition is not a problem. As we start heifer number 2, again, we'll lube. We will do the reproductive tract score, a score from 1 to 5. Hopefully all will be 4 or 5. We'll insert the rice pelvimeter and measure the vertical, which is the bottom of the spinal cord to the opening of the pelvic canal. That measurement's 14. And then we'll rotate the pelvimeter and measure the widest part of the opening of the pelvic canal, and that's 12. Multiply those two numbers together is 168. This 13-month-old heifer weighs 678 pounds, so her conversion factor is 2.15. Divide 168 by 2.15, and she can have a 78-pound calf or lighter without having calving difficulty. Thanks for joining us on another episode of Beef Minutes.